this roundtable discussion on making a smart investment, evidence that worker health programs benefit everyone. And I'd like to also welcome those of us who are in the room, first of all, and those of us who are joining online from all over the world. We have an excellent program for you, as well as an esteemed panel with us today. Before we get started onto the program, I'd like to quickly just go over the agenda. I need the mouse, excuse me. So today we will start with a few opening remarks from senior leaders from our organizations, as well as we're very lucky to have His Excellency Peter Mollema, the Ambassador of the Netherlands to Egypt, speaking to us from Cairo. We will set the stage about why we need to invest in worker health programs, and we will have two presentations, work of the Population Council and how we have evolved over the years in working in workplaces, as well as a recent case study from Egypt. And then we'll have a panel discussion with our panelists who we will introduce to you as we go. And before we get started, I'd also like to thank the United Nations Foundation for hosting us here today in this lovely venue. And to get us started, I'll ask Dilly Severin, the Executive Director of the Universal Access Project, to say a few words.
Can you hear me? Okay, perfect. So good morning, good evening, everyone who, I don't know where you are in the world, but welcome. Thank you so much for joining us. Thanks to those in the room for joining us, those online, and of course, thanks so much to our esteemed panelists and to His Excellency Ambassador Mollema for joining us online as well. As Ashish mentioned, I'm Dilly Severin. I'm the Executive Director here at the Universal Access Project at the UN Foundation. The Universal Access Project, brings together stakeholders from different sectors to advance sexual and reproductive health, rights, and justice globally. Essential to our work is this idea that, when women are able to sort of make their own decisions about their futures and their lives, they can participate in economies and communities and more. And so, that's why, an essential part of UAP's mandate is partnering with the private sector around advancing workplace health and well-being, and wherever sexual and reproductive health and rights is a part of that, of course, we see that as an amazing thing. I think it is an understatement to say that we are in a potentially very challenging global moment right now. Looking at the recent sort of SDG progress report, we see that only 17% of the Sustainable Development Goals are on track. We know for our family planning specifically, bilateral assistance is at the lowest level that it's been since 2016. So we are really in need of ideas about what works and solutions that can inspire action. So I think that's why I am really excited about our conversation today. For me, the case studies that we'll be learning about really sort of exemplify the importance of how partnership can contribute to overall worker health and well-being, and really actually provide that foundation of what are those critical lessons and bright spots that allow us to actually move forward in a really challenging time. So I would just say again, welcome to all of you, and thanks so much for joining us. And I'll turn back over to you, Ashish.
Thank you so much, Dilly. We are also very lucky to have Dr. Thoai Ngo, the Vice President of the Social and Behavioral Research Science Program at the Council, with us today. And on behalf of that Council, if you could say a few words, Thoai.
Thank you. Thank you, Ashish. Thank you, Nahla and David, for organizing this event. And thanks, Dilly, for joining us today. I also want to extend my warm welcome to everybody online and in the room, but also particularly the ambassador for joining us, and you'll hear from him briefly. But for those who are not familiar, the Population Council is an international research organization, and our work spans across 30 countries, and we collaborate with government, private sector, nonprofit, researcher in the global south to advance sexual and reproductive health and rights, to advance gender equity, to empower the largest generation of young people to reach their full potential, and to address climate justice. And maybe I'll go into a little bit of why we care about this issue so much at the Population Council is that 90 million workers work in garment industry. And if you look on any of your garment this morning, when you get ready for work, when you get ready to take your children to school, many of them are made in lower middle income countries. More than 70% of the 94 millions are women, and the majority of them are migrants, which is a major population trend that is happening from rural to urban setting. Many of these factories, garment factories, are located in urban settings. So while I am encouraged, I remember vividly when I visited the Adidas factory in Vietnam. I hail from Vietnam, and Vietnam is the #2 leading exporter of garments to the United States. And I remember working with Marie Stopes International and how transformative it was for women and girls to get contraceptive products or basic woman health checkup right at the factories that they were working. So I am encouraged by the private sector and the government trying to improve the condition of workers in many places. But as we all know, that workers continue to face sexual harassment, long hour, unsafe conditions, and as through our evidence, it's continued to demonstrate that sexual and reproductive health and rights for these women continue to be diminished. And I want to bring another angle into this conversation. With the rising temperature, exacerbating in the flooding events and rainfall, it's going to continue to make these conditions for these workers worse. So I really think the conversation today is going to be more pertinent than ever. And you'll hear some of the stories and evidence from my colleagues Nahla and Ashish later. But I would encourage us to really think about addressing these multifaceted issues for this particular group is really important, that we need to take a multifaceted and multi-sectorial approach. Not only it is an economically smart thing to do, because just in Bangladesh alone, women account for about 85% of the garment workers and contribute to about 11% of the country GDP. And in Cambodia, where Ashish knows well, 80% of the workers are women and contributed to about 5 billion in revenue. So we need to also take not only the equity lens, but the gender lens when we talk about worker health program. So I just also want to thank all the panelists who are partnering with us today and welcome you all. And I look forward to a fruitful and actionable discussion. Thank you very much.
Thank you so much, Thoai. Now I have the privilege to request His Excellency Peter Mollema, the Ambassador of the Kingdom of the Netherlands to Egypt, to say a few words.
And I thank you for inviting me to speak to you. Thank you for the panelists. Thank you for the invitation. Welcome to everybody here and online. I don't know what you actually know about our program here in Egypt. I have been ambassador here now for about a year. And let me say that one of the highlights that I did in this past year was visiting a project in Alexandria. The project was providing family planning needs to workers really in the workplace. And it's, well, you can put this in all kinds of words, but we are looking at a factory that produces sports clothing for Adidas and for Under Armour, and they sell it in the US and in Europe. You must imagine there are sitting hundreds and hundreds of men and women in long rows behind sewing machines, getting all of these stuff together. And then you realize suddenly, when you walk around, then you start talking about family planning. There is a mobile clinic there available to these men and women. There's a doctor available. They have meetings together where they discuss all of this. And let me just share with you some of the testimonials that we heard, or that I heard. And one woman, she said, and I'm reading this, I had body reaction from the IUD, and I did not have time to see a doctor. But with the arrival of the mobile clinic, I was able to get help, and I changed the contraceptive that I was using. This has helped me health-wise, as I was always very tired, and it has allowed me to continue my work as usual. Another married woman said, at the beginning, I was shy and embarrassed to go to the mobile clinic, as it was meant for married women, I thought only. But if I go, some would talk behind my back. Other colleagues would then encourage me to go and get advice for the future. And the doctor in the clinic was very friendly and explained many issues that no one had before talked to me about. Just two things that women share. But family planning is often seen, of course, as a woman's responsibility. And most of the time, these decisions are made in the discussion between husband and wife, belong in the private domain. But one of the things that was remarkable about this project was that there were also men participating. And one male participant said, I personally accessed the mobile clinic to get some commodities, hinting to condoms. And when I ran out of them, I went again, and they provided me everything for free. It does show that men also benefit from the initiative, and many expressed their willingness to continue to participate, to go to the doctors, to ask questions, and ask questions that they otherwise would not have asked. And I think these testimonials show a little bit of the dynamics that you could see happening in the workplace. I was very much positively surprised at how open they talked about these things. I, as a stranger, coming in there, in that factory, in a meeting room, hundreds of men and women, and they openly talked about these issues. And not only did they, so did their workers. So the factories and the owners, they emphasized how the mobile clinic, the awareness, the information sharing has led to lower absenteeism rates and more retention of the female staff. In other words, it's not only beneficial for men and women, but there was a concrete example that is good for the company as well. Or if you want to put it differently, in other words, good family planning is good business practice. This is what's shown there. But you can do a project, and when you leave, such a project can stop and disappear. There has to be a reason for them to continue. We have entered into a sustainability arrangement with the Population Council. Thank you very much for the cooperation. And that helped establish and ensure the continuation of the mobile clinic services to factories beyond the project's life. There was a dedicated committee. There were factory nurses. There were representatives of health committees. And the Egyptian Center for the Advancement of Health Technologies participated. That will continue to coordinate all the visits to the workers, together with the Ministry of Health, and thereby allows these factories to continue with these kind of services. And as my remarks, I would really like that the message that I'm trying to bring, that as the Netherlands, we think that this is the key. Bring something, services to people that are beneficial to them, allow women to make their own decisions as they should, but allows men to participate, and at the same time yield a result that's beneficial for both sides. And that's something I think one should be proud of, and I hope we will be able to continue to do that, because this project is a testament to the power of that collaboration between all parties involved, and I hope that these factory workers in Alexandria will be an example to others, will be able to continue to use these family planning services. And I hope that here in Egypt, the government and the private sector will then be able to continue and bring out these services to others. But I would like to say, this is not always an easy country to operate with these kind of discussions. There are obviously social boundaries that you have to take into consideration, sometimes religious boundaries, sometimes the role of the government is not automatically accepted. But the moment you can do this in a way whereby you empower the women, I can tell you, you leave them that place with a happy heart. And in any case, you leave it after you've spoken to these women with the positive assurance for yourself that there is possible to change things and to do things in the right way. And I thank all the partners that were active in this project with us for all the things that they have done. Finally, let me wish you a very good and positive webinar. My colleague Caroline Nassif will continue to join you in this particular meeting. And I thank you again for allowing me to speak and say a few of these words. Thank you very much.
Thank you very much, Mr. Ambassador. I'm David Wofford with the Universal Access Project of the UN Foundation. It's really great to be here, and I'm here to frame our discussion today. And I just want to say we hope it's a roundtable discussion with our panelists and everyone online around this table. And I want to say this is great to co-host this in part because in a former life I worked with both of our presenters in Cambodia and Egypt on these issues of women's health and workplace programs and policy change. So it really comes full circle for me. And I think, we want to talk about how to frame this around the big discussions about why it's so important to invest in women's health, how to drive corporate investment in workplace health programs and policies, but also, how public-private partnerships and the interlinkages can improve workers' lives, benefit business, but also strengthen the overall health system and development. So we need to think of it broadly. So just a little background about Universal Access Project. We've been tackling these questions and issues for about 7 years in our private sector Action on Women's Health and Empowerment initiative. We're a convener. We try to promote other people's work and promote good ideas and change that will be sustainable. We've also invested in with colleagues in research on the business benefits and the workplace benefits of these kinds of programs. And right now we're really interested in how we drive sustainability and systemic change for industry, government, labor, and other stakeholders to think about workplace health. So we have 3 things right now that are really important that we're excited about. We have an accountability platform to drive this action and build champions and networks of organizations from family planning and women's health and workers' rights and well-being and labor and gender equality to think about how collectively we can drive accountability and drive change on these issues. As part of this, we've just announced in partnership with Global Citizen a call for corporate commitments on women's health to drive action around the world, both in workplaces and communities where they operate. And finally, for the last 3 years, we have been part of and helping to manage a pooled corporate fund called the Resilience Fund for Women in Global Value Chains. And this is one of the most innovative public and private models of collective action, which is charting new ways to invest in women, workers, and communities, but also to think about how we change the way we talk about impact and results and sustainability. So to frame this, let me just raise some of this challenging moment we're in and just be very clear, it's unusual. First of all, many sources of public funding are drying up. We have to be clear on that. And the civic spaces where we operate in are much more difficult and getting more difficult. Corporate funding is focused importantly on climate change, but overwhelmingly this is going to mitigation and not resilience and adaptation. And the reality is the climate change impacts are here now, and we need to be thinking about how we help workers and communities deal with it in the current time, not 10 years down the road, it's too late. And I'll just say funding for workplace health and women's health in business is always been a difficult fit. It really doesn't fit squarely in any of the funders' boxes. It has this odd middle space cutting across issues like economic empowerment, gender equality, climate, living wage, workers' rights. So the family planning people don't want to invest in workplace programs, and economic people don't want to invest in women's health and family planning. But We call it not just cross-cutting, but a curb cut, but it's hard to get funding on that. So one of the other, so we look at also corporates, and for many reasons, they aren't funding this because it's secondary to what's considered material right now. And as they respond to new reporting and due diligence requirements, this does not rise at this point as central to materiality for many of them. And then labor tends to view this as an important issue, but through the more narrow occupational health and safety lens. So it's a tough spot we're in just in funding and other things. So let me just give you a few data points on why women's health is so important generally and for development and business, but also why it's so material to business. Earlier this year, McKinsey Insight report came out. You may have seen this. They say about $1 trillion of economic development is lost because of the disparate health impacts on women compared to men due to illness and disease. And yes, there's a reproductive health component to this, but it actually is much more high impact around a range of diseases both men and women have. And this harms women in their prime, most productive work years. Second of all, Cornell Global Labor Institute just calculated the cost of heat and flooding in 4 major countries where apparel works, and makes a strong case for why workers and why companies need to invest in resilience, and that needs to be funded. And thirdly, just to say there's a huge body of evidence right now on the disparate impacts of climate change on women, to their health, to their violence, to unwanted pregnancies, migration, caregiving. So climate change is directly related to this, and we have to recognize it. For many of us, the question is why we have to be answering this question at all, why it's important to invest in women's health and workplace health programs. There's 25 years of experience or more around this table and online on what works and doesn't work and what needs to be done. So the speakers today will have more to say on this. And yes, we do need more champions and more evidence. So I'll add that when we talk about corporate investments in workplace programs, it's not just about funding. I want to be clear about it. It's about how we invest money, time, resources in better policies, practices, operations, and yes, programs, long-term programs that ensure women and men have access to health information and services. It's also about how we think more creatively and structurally about how workplace health and public health systems can connect together and respond to the health needs of workers and communities. So on that note, I turn it to Pop Council. It has done invaluable evidence over the years on why this is important, and will give heft to this discussion. And I'm pleased to turn it over to Ashish to get us going.
Thank you, David. Can you all hear me? I think this mic is working. Okay. I will speak today, let me make sure I can move the slides, about the population councils, the evolution of the population council's work in this sector. We've been working in this sector for almost 15 years, and I want to give a little bit of a flavor of what we've done over the years and how our work has evolved from small pieces of work to a much more larger portfolio. David has nicely set the stage for us. When we began this work in South and Southeast Asia, we were very clear about the well-documented risks. But it was also clear to us that women specifically, but overall workers, had limited access to information and services, and there was generally a very limited body of evidence around what works in workplace health. So we saw the need. However, as I will talk about in my presentation, our work, I'll talk first of all about sort of our overall history in sexual and reproductive health and family planning in ready-made garment sectors, but we'll specifically focus on 2 pieces of work. One, an evaluation of BSR, Business for Social Responsibility's HER project in Bangladesh, and the Worker Health Project in Cambodia, which we designed together with David and Marie Stopes International, and a few ways forward as the work has evolved into the work in Egypt. Our earliest work in South and East Asia began with some of our transitions to adulthood work, which the Council specializes in globally, and we had a long history of work in Bangladesh on transitions to adulthood, so it was a natural progression to work on transitions to adulthood of young female factory workers in Bangladesh. This was work we did in 1997. It was qualitative. It was very, very formative. We also worked with the Hanoi Health Department and tried to better understand living conditions of factory workers in Hanoi, including outcomes such as gender-based violence and how they dealt with that. We all know about the Rana Plaza disaster. Post the Rana Plaza disaster, we worked on broadening the scope of how we engage with the garment sectors, bringing the conversation beyond occupational safety and health to broader areas of women's health in a place like Bangladesh where the workforce is predominantly female. So the council's entry points were around our areas of expertise, sexual and reproductive health and family planning. And we invested mostly in South and Southeast Asia at the time. So from 2013 onwards, however, our work has become much more focused. We started with a smaller evaluation of BSR's HER project, and we then moved on to a comprehensive program that we developed that was called Worker Health. And then we've now moved on to working in Egypt. I'll talk about both of these programs in detail. So before I do that, I think maybe most of you are familiar with this, and Thoai kind of set the stage a little bit already on the sectors in Bangladesh and Cambodia. Our numbers might not match perfectly because these are 2019 numbers, but it'll give you a sense of the scale of how big these sectors are. In Bangladesh, this is 2019, 4.1 million workers. They have over 5,000 factories, 65% female, injects $34 billion into the economy, and it accounted for 84% of their exports, excuse me. In Cambodia, it's a slightly smaller sector with less than 1 million, about 800,000 workers in 800 factories, 80% female, but still delivering $8 billion into their economy and accounting for 71% of their exports. So in both of these countries, the female workforce are not only important constituents for their economies, they're major pillars of their economies, as David pointed out, but they are also major political constituents. So it's a very important sector. And in these countries, it became apparent to us that it was very important to engage. So I'll talk about BSR's HER project in Bangladesh first. I think many of us in the room are probably familiar with HER project. The Population Council at the time was leading a USAID-funded $70 million implementation science project. That was a global project focused on reproductive health and family planning. And so BSR and the Evidence Project together collaborated to evaluate the HER health component of the HER project program in Bangladesh, a comprehensive program aimed at improving female worker well-being. It had components of knowledge and access, sustainable interventions, and advocacy. This tested outcomes such as general health outcomes, including sexual and reproductive health and family planning, uptake, and knowledge. So if you look at this graphic here, you'll see the scale of BSR's HER project in Bangladesh. It reached over 176,000 workers, trained 5,400 peer health educators in factories. It functioned in 117 factories in Dhaka and in Chittagong with their local partners, Change Associates, Awaj Foundation, and Mamata Foundation. If you look at the list of buyers at the bottom of that slide there, you'll recognize a lot of major international names. So these factories were providing apparel for a lot of major global brands, and so this project was very important. So what the council did, or what the council was invited to do, was to come and evaluate the interventions using a rigorous quasi-experimental design. I won't get into the details of what that specifically means, but we used control. We compared intervention factories and what was happening in intervention factories with a set of comparison factories where interventions were not being implemented. And we found, even in this rigorous design, that the HER health interventions had positive impacts on knowledge and behaviors related to menstrual hygiene, positive impacts on workers' knowledge of STIs, HIV, recommended antenatal care, and the use of contraception. And most importantly, there was a significant impact on the use of modern contraceptives. And we also found through some qualitative research that factory managers were supportive of this intervention, which sometimes is a challenge, and that the workers and their health was valued by the manufacturers. And I think that was an important finding. While we were implementing this evaluation in Bangladesh, through the evidence project itself, the USAID mission in Cambodia invited the Population Council, Marie Stopes, and Meridian Group, of which David was formerly, to design a more comprehensive approach to worker health. And so with a significant funding envelope, as you can see, it was about 3.8 million over 2.5 years. And initially, it was USAID's largest grant for health in the garment sector in the world at that time. So we had sufficient resources, and we designed a very comprehensive program that included a learning agenda. So we conducted research, which I'll talk about in detail. We had a component for the enabling environment, also around policy and advocacy, and health service delivery and access, which was led by Marie Stopes International. And this was designed as a living project. So the research guided the interventions were assessed. As part of the learning agenda, we really wanted to put the workers front and center and ensure that their voices were heard. So we assessed using qualitative research to understand what the workers' needs were. We assessed what programming had been done in Cambodia, what were the gaps, so that our interventions could fill those gaps. We tried to change the status quo in that we placed renewed emphasis on research and evidence and how it's viewed in this sector. So I've just put a few photographs of some of the convenings through which we did that, and it involved all kinds of stakeholders, manufacturers, brands, the Ministry of Labor and Vocational Training, UNFPA, multilateral and bilateral donors, workers, unions. So we brought all of these partners to the table. And we explored understudied topics. We did a situational analysis of garment factory worker health in factories in Phnom Penh and Kandal provinces. These are the two key provinces in Cambodia where all of the factories are based. We did a very unique study on housing and living conditions of garment factory workers in partnership with H&M. I'm not going to go through the findings because I have limited time, but what we did find was that there were very unique circumstances of garment factory workers in Cambodia, and that helped us design the intervention, which I'll talk about in a second. At the end of the project, we did do a qualitative post-intervention assessment, which showed that the project was well-liked, the workers appreciated, and I think I heard a lot of that in Ambassador Mollema's comments today in Egypt as well, and forged new partnerships. I think the partnership with H&M was very key for us, as well as building the capacity of national research institutions, such as the National Institute for Public Health, which is a parastatal organization, and Angkor Research, a private organization, to do robust research in garment sectors. We all know that doing research in the garment industry is very challenging because you have to go to workers who are working during their work days, bring them out of their work lines. So we built capacity doing that. As part of the policy and advocacy work that David led, we did the first of its kind stakeholder analysis, analyzing power dynamics of different stakeholders. And that helped us really to understand how and who we should be engaging with and how to engage with them to ensure that our interventions are taken up. And as one of the more important achievements of the program, we led with a large group of partners who you see with the logos here, the establishment of the guidelines for enterprise infirmaries. And this was written into official policy, and you can see the Minister of Labor and Vocational Affairs here signing that into law, and that continues to today. We also were acting as a trusted partner, essentially as a trusted broker among stakeholders that often have competing interests. In this picture, you will see that there is H&M at the table, the Ministry of Labor and Vocational Training, USAID, and WaterAid. This was part of the dissemination for the Housing and Living Conditions study. And to this point, these stakeholders really hadn't gotten on the same table before. And that was an important contribution from the project. So I'll just quickly go through the worker health intervention. We had a communication strategy through SB, social and behavior change communication strategy, social media, influencers, working in factories and communities. We strengthened the infirmaries in the garment factories. Garment factories in Cambodia are required to have an infirmary, but there was no standards, and so the infirmary guidelines set that. We established a referral network, and with the referral network, a set of quality assured family planning providers around the factories. In our research earlier, the workers in the factories clearly told us that they want health facilities to be around their factories, beyond the infirmary. So we established a quality assured network of family planning providers. This work was led by Marie Stopes International. And one of the key innovations was an app for the referrals, during which we mapped every single health facility at every level in the 2 provinces that we were intervening, as well as geotagged all of the factories, so that this referral app, based on what the woman worker would come to the infirmary and say if they needed a certain service, this app could refer you to the closest service provider through this system, and then send a referral through SMS. So during the project, we were able to do almost, in a short period of time, in about 2 years, we were able to do almost 19,000 referrals, over 20,000 voluntary family planning services through the Quality Assured Network and infirmaries, which resulted into over 4,000 couple years of protection and over 5,700 unsafe abortions averted. So this is my final slide. A couple of thoughts on the ways forward before I hand over to my colleague Nahla. One of the key things that we wanted to do was to document this model so that it could be replicated in other geographies where the sectors are similar. So Bangladesh, Vietnam, Myanmar, Egypt have predominantly female work sectors. But however, we think that this model is also fit to be adapted and modified for other places where the manufacturing sectors are getting big. And we really do think that this has potential in East Africa. In terms of our knowledge and technology transfer, our knowledge products really set a high standard for how evidence is collected and also disseminated, and how it's used. And they were being used, and this has been over 6 years since we finished this project in Cambodia. The mHealth app, even though it may not have continued exactly as we designed it, the National Social Security Fund, the health insurance program of the country, used it for their own referral services, and the infirmary guidelines, as I mentioned, are officially policy. So as we think about new geographies, I think the learnings at least informed the work in Egypt, and Dr. Nahla will speak about that in a second. But we do want to think about themes that are broader than just purely predominantly female workforces. We think this has implications for both men and women. And we want to think about, as we go forward, and I hope this is reflected in the panel discussion, that we want to have a more of a well-being approach to it, as opposed to specifically reproductive health and family planning. So with that, I'll hand it over to Nahla. Thank you.
Okay, thanks, Ashish. Hi, good morning, everyone. Thank you for joining in, and I'm pleased to talk about the work that we did in Egypt, and which His Excellency Ambassador Mollema referred to. Let me first give you a little bit of background about the population and family planning situation in Egypt. As many of you know, Egypt is a densely populated country with a population of over 100 million people, all concentrated in 6% of the country's land. We have a rapid population growth rate of 1.6%. We add almost 1.6 million every year to the country's population. We have a relatively high total fertility rate of 2.85. And this rapid population increase is posing a financial burden on the country's limited resources. And this is something that you can see in like school classrooms, in health services, transportation, and so on. The percentage of women who are practicing any form of contraception is 66%, which is relatively high. However, unmet need for family planning is high too. So 14% of women who do not want to have children in the next 2 years, or who do not want to have children and any more children, are not using family planning for various reasons. Main reasons are concern about side effects. And we have also a large percentage of unplanned pregnancies, 1 in 5 pregnancies, and this is, again, for various reasons. One is fear of using contraception or incorrect use of contraception. The reasons why we thought about offering family planning information and services, my colleagues David and Ashish have referred to that. I'll give you a little bit of background on the number of workers in Egypt. They're garment workers. They are not as big as in Cambodia or in Bangladesh, but it's a sizable proportion of the population. 2.5 million workers in the garment sector. These are the officially registered. In addition to that, there is an additional maybe 1 million who work seasonally when there are work orders. And about 50% of those workers are women of childbearing age. They have the garment sector, garment factory workers. They have limited education. They come from lower socioeconomic backgrounds. They are underpaid. They commute to factories from surrounding villages and slum areas. And they have widespread misconceptions about family planning. They don't know, because the sources of information that are available for them are very limited. This information is not offered in mass media anymore. It's not offered in schools. And those people, they don't have time to go to health services to seek information. And as Ashish mentioned, the evidence from population council's work in Bangladesh and Cambodia has shown a high demand for family planning, and that there are some good practices that could be adopted. So the Council's engagement, PC Egypt engagement in offering family planning services to factory workers, it started back in 2017 under the USAID-funded evidence program. We implemented a pilot project, which David was part of that project, which was implemented in 8 factories in Port Said Governorate, which is an urban governorate, in partnership with a local Egyptian NGO. The workers under that model, they received family planning information through the factory nurse and through trained peer educators and through SBCC materials, that's to say flyers and posters, and they were referred to trained private sector doctors. So services were not offered on site for those who wanted to receive family planning, but they were offered through trained private sector providers in their clinics or in their pharmacies. The intervention was well received by workers and managers, but with challenges in accessing private sector services. Workers, when we did an evaluation at the end of the project, workers indicated that these services were too expensive for them to go and seek services at private sector entities. And also, the workers, they had to commute and go back to their villages, so they did not benefit from those private sector providers. Our second experience, we did that collaboratively with JSI. We evaluated a peer-led family planning awareness intervention under the USAID-funded strengthening Egypt's family planning activity between 2019 and 2021. The activity, as I said, it was led by GSI, and Pop Council was a subcontractor. Family planning information was offered to factory workers in 9 governorates in Upper and Lower Egypt by trained peer educators who conducted meetings with workers, and through SBCC materials, flyers and posters. The workers were referred to public facilities for services. So again, no on-site provision, but they were referred to public services. And we did a mixed methods evaluation, which revealed improvements in family planning knowledge and attitudes, but an insignificant increase in method uptake. Again, because the services were not offered on site, and workers did not have time to go and seek services during the workday. Our third project, which is the one that the ambassador has referred to, is the on-site provision of family planning information and services. We're conducting this project in El Amriya investment zone in Alexandria in 10 factories. The intervention is implemented in partnership with the Egyptian Chamber for Apparel and Home Textiles, in partnership with the Ministry of Health and Education, Ministry of Health and Population. The Ministry of Health provides the services, while the Chamber communicates with the factories, and financial support is provided by the Netherlands Embassy in Cairo. So the model in Alexandria, we built on the learnings from the previous 2 models. So family planning awareness raising is offered through peer education, SBCC materials, and one additional component which we introduced this time was social media, was use of WhatsApp messages, because we learned in the past from our previous experiences that workers and peer educators didn't have time to communicate together during the workday. So WhatsApp messages were used to support that. The factory clinic, the nurse offered family planning counseling to workers and referred them to the mobile clinic operated by the Ministry of Health. So she coordinated those visits. The mobile clinic visited the factories every 2 to 3 weeks, depending on demand, and they offered family planning services, reproductive health services, as well as antenatal care and breast self-exam, a whole range of family planning reproductive services, free of charge. And here are some pictures of the nurse with the workers and the peer educators talking with workers. And on the left are the WhatsApp messages. The one on top talks about the oral pills, and the bottom one says, if you have any questions, go to the factory nurse. And the flyers are on the right. The WhatsApp messages were sent twice a week, and they were sent in the evening, so workers would be able to look at them and even discuss them with their families. And this is the mobile clinic. The mobile clinic is a van that has the driver is a male, but he's separated by a partition. And the back part of the van has a female doctor and a female nurse, and this is how the services are offered. The project, we evaluated the project using a quasi-experimental design with a baseline and end line in intervention and comparison factories. So we had 806 workers in intervention and 753 in comparison factories were interviewed at baseline and end line to measure changes in family planning knowledge, attitudes, and practices. We also did a qualitative assessment where we asked workers, managers, and peer educators and staff to get their perspectives on the project, the benefits, strengths, and weaknesses. So preliminary results, the results are have just been completed, so we're still in the analysis, but preliminary results, which I'm very happy to share with you, is that there has been an improved family planning knowledge and attitudes in intervention factories at end line compared to baseline. And there has been an increased family planning uptake in intervention factories. Baseline was 67% compared to 79% at end line. And there is high level of satisfaction among workers and managers and willingness to sustain activities. And this is what the ambassador referred to, a willingness and keenness actually to sustain activities beyond the life of the project. And here are some of the testimonials in addition to the ones that you heard from His Excellency. So this is a female worker who says that the services were very good at the mobile clinic and that it was very convenient because it's situated right in front of the factory and the prices are so high outside. The mobile clinic made it a lot easier for women to access services because services were offered free of charge. And this thing about convenience and having the clinic right in front of the factory made a lot of difference. This is a quote by a male worker who said that he had learned many things through the project. He learned about birth spacing. My son is 2 years old. Me and my wife have decided to wait until he turns 3 before attempting another pregnancy. I also learned that family planning is not a sin. And here I'd like to mention that male workers initially were not very interested in the intervention and they didn't want to join the WhatsApp groups. But when they heard from their co-workers, they got interested, but they said that they wanted to learn about other topics and not only family planning. So diabetes, hypertension, weight loss, and so on, smoking cessation, and so on. And the third testimonial is by a manager, a factory manager. He said that the workload in the factory does not allow workers to take time off to seek services outside the factory. So by having services come to their doorstep, workers' attendance improved as they could receive services and come back in less than half an hour. And this here, the role of the factory nurse was crucial because she coordinated that. And also here, I'd like to mention that there is a system in Egypt, I don't know if it's applied in other countries as well. Workers receive a bonus at the end of the month if they do not miss any work days or any work hours. So if they do, they miss the whole bonus. So that's why workers are very keen on not going and receiving services outside. So by having services inside the factory, it helped workers a lot to keep their bonuses. So lessons learned, although both male and female workers have unmet needs for family planning, information and services, male workers have needs for broader health messaging. So this is something we need to keep in mind for future interventions. Public-private partnerships could play a significant role in addressing workers' health and family planning needs at minimal costs for each party, because Ministry of Health, they have those mobile clinics that they are operating and they are always complaining that those services are underutilized. So by having them go to a designated location with a high number of workers, we had them offer services to about 70 workers every time they come, while they said that normally the turnout would be about 7 clients. So there is high demand for their services. And finally, on-site provision of family planning services benefits workers, businesses, and the economy through averting those unplanned pregnancies. So the whole economy for the country would benefit from that. I'd like to acknowledge the generous support from the Netherlands Embassy in Cairo and our partners, Ministry of Health and Population, the Egyptian Chamber for Apparel and Home Textiles, our partner factories who've been very cooperative, and the project team in Cairo. Thank you all for your attention. I'll be happy to answer any questions. Thank you.
So we're now going to open this up, and I'm going to ask Nahla a question, but I also want to introduce our panelists and get their perspectives. And we brought together people from different perspectives, and we really want to talk about the intersectionality around this and the issue of sustainability and how to move forward in driving these kinds of investments and partnerships on health. So I'm really pleased to also have Emily Janik, the Associate Vice President of Thought, Leadership and Design from CARE USA, and Komala Ramachandra, Head of Responsible Sourcing and Human Rights and Gender at GAP, and a partner on a Resilience Fund. And also, very pleased to have Sarah Craven, the chief of UNFPA North American Representative Office, to bring in different angles on this. But Nahla, I'd love to just start a question with you, this last piece of the government and the value. And the big issue that hangs over all these are sort of one-off programs that show all these great results, and then there's no one to continue funding it. So if you could sort of talk a little bit about what the government roles is, how this is going to be sustainable, because, you know, there's a lot of elements. There's the management and being supportive, nurses, referral, and the government. And just be interesting, though, how you pulled this together and what makes this sustainable going forward.
Okay, thanks, David. Yes, the government is very, very keen on sustaining this intervention. The government is always talking about addressing unmet needs for family planning. So having this audience, the family planning, or those workers, the factory workers, this is a population that the government is very happy to reach out to and to be able to address their needs. In the factories where we are working, we have set up, as His Excellency, the Ambassador mentioned, we have set up committees composed of peer educators, as well as the health and safety staff and human resources, as well as the factory nurse. So they will be coordinating with the health directorate in the governorates where we worked in Alexandria to sustain the services, and this happened already. So we've pulled out from those factories, and we let those committees take over, and so far, like 3 or 4 visits have been conducted successfully with no intervention from Pop Council or from the chamber. The next step is, over the next 2 months, we will be communicating and bringing in various chambers besides the apparel one, and to try to get their buy-in for implementing similar interventions within the factories. We will bring in Ministry of Health and Population, and we are trying to get the Federation of Egyptian Industries and have them together sign an MOU to decide the roles of each party, what Ministry of Health can offer and what the factories can offer, and what role the Population Council can play in facilitating this collaboration. I think it's going to be doable and it will be sustainable. Thank you.
And what I'd like to do is turn over to our panel, just get their reactions and resonance, or if there's a question from the presentations you heard, and particularly in Egypt, what resonates with you in your work or doesn't resonate, either way. And Emily, why don't I start with you? From what you've heard, you need to press that button and bring it close to you.
Yeah, one of the things, especially the work in Egypt you all were talking about, that really resonates for us is the importance of changing what you're doing based on what you're learning, right? That adaptation, looking at the evidence and then saying, this part wasn't working, now what do we do? Or it works, but we can't sustain it, now what do we do? And that's really critical. Part of what we've also learned is you have to bring a lot of stakeholders into that conversation. It can't just be a conversation between the researcher and the project manager, or we get these examples where people say, sorry, not sitting close enough. If you are having those conversations sort of just with the project team and the research team, you start to build research that's only talking to yourself. And so one of the examples is when we talk about business cases, I've had factory managers say to me, those business cases aren't useful for me because you didn't include employee time, which is my biggest expense. And also the employees care a lot about what they're spending their time on because of the way they get paid. So you built a business case that's not relevant for me. So thinking about who's at the table while you're making both the decisions of what data you're looking at, but also the decisions about what you do based on that data is really critical, because these are larger systems. And if we want to be sustainable, we have to start from the beginning, thinking about the system and not just the project.
Komala.
Thanks very much. It was really interesting to hear your presentation. I was taking a lot of notes furiously because I think it's super fascinating and a lot of learning for us potentially in our own supply chain. I would totally agree with what you mentioned around constantly adapting and moving forward. I think that's really important in terms of building programs that work for all stakeholders, right? And making sure the voices of all those stakeholders are part of that discussion. The other piece that I think was really interesting was at the very end, you mentioned the sustainability pieces, transition to government, and also scaling. I think that for us is a huge consideration when we think about programs that we want to implement in our supply chain. How do we scale this across factories in a single country, but across factories globally, and that buy-in from private sector to implement programs like this. And so I'd love to hear at some point your thoughts on scale, the challenges to scale, and what is actually needed to be able to scale these programs to a larger level.
Hi, Sarah.
Thank you so much. I'm with UNFPA. I don't know how many people are familiar with us, but we are the UN Sexual and Reproductive Health Agency. And so, of course, lots of synergy with our mission and mandate in POP Council. And I just want to say what an interesting presentation. I think I was really moved and struck by the quotes you had at the end of the different stakeholders. And, a moment of pause on the factory manager who's basically, shortest amount of time possible. And so I'd love to hear more about something that we all struggle with is on the rights and choices piece of that. And I know part of this is empowering the women and empowering the workers and that they get their own sense of empowerment. But how do we also ensure that balance between being a worker and getting your bonus and also being your bodily autonomy and your rights? And how is that integrated into the project?
You want to respond to those?
Yeah, thank you. Thank you for those questions. Let me first start with Kamala's and say, what scaling up? I think some of the components of the intervention may need to be dropped. The service delivery piece is core. So it's making all the difference to have the services offered by the mobile clinic. The messaging and the awareness raising could be done by the factory nurse with a little bit of training. So we looked at the cost actually of the intervention, and we're still looking at the data, so I'm not able to share them yet. But the cost of the intervention is very low. So training the nurse, even training the peer educators, that's like for 1 day or for 2 days for the nurses. Printing the flyers, sending out the WhatsApp messages. These are all they cost very little, but they reach a large number of workers. But if I'm to prioritize for scaling up, I would focus more on the service delivery piece as well as the factory nurse, because she's there. She's there. There is an infirmary by law. Every factory should have an infirmary and a factory nurse, and she's underutilized. She felt very fulfilled by playing that role and providing counseling to workers. So in that order, and the last piece would be the family planning awareness raising through flyers or through peer educators or WhatsApp. The question on the workers and the creating the balance between their body needs, and I think by having the services offered, we need to make things easier for workers. So having services outside the factory, this has shown one time after another is that it is not feasible, and those factory workers are so underpaid. So 1,000 extra pounds to them makes a lot of difference. So having services inside the factory and the coordination with the factory nurse is going to make them do both. And I was so glad to see that the factory managers were also they bought into it. So initially they said we're only going to allow the mobile clinic to operate during the lunch break, but not allowed before or after that, so you do not interrupt work. But gradually, when they saw that there were 70 workers who wanted services, and instead of having those workers leave and go to receive services elsewhere, they saw for themselves the great demand for the service, and they allowed the mobile clinic to stay longer, and they allowed workers half an hour from the workers' time is not a big deal, because before that they used to leave for 2 or 3 hours. So I was also glad to see the change in the factory managers besides the workers and the nurse and peer educators. Thank you.
You know, Kamala, this sort of ties into GAP's long experience with the PACE program, and now it's part of RISE, and this whole issue of management ownership of this. And I'd just love to hear you talk a little bit more about this very issue of time, worker time, how you get buy-in, how do you make it sustainable. We talked a little bit about this, and love to hear your insights relative to what Nahla just said in terms of getting ownership on this.
Absolutely. So for those who may not be familiar with the PACE program, it is a program that came out of the work that Gap Inc. was doing in our factories globally, starting with compliance with working conditions and making sure that worker health and safety was being protected in all our factories. I think it's really important to flag that that was the starting point, and from and a necessary starting point. And what we saw was, what we wanted to do is think about what else could we do as a company to support workers in our supply chain beyond just the baseline, which is compliance with international and national standards. And so our team at the time, our program started in around 2007, did a needs assessment in factories that we work with to understand what workers wanted and needed in terms of additional support. We worked with partner organizations to develop then programs and a curriculum to provide life skills training for women workers in our supply chain. And includes modules across a wide range of issues, including decision-making, communication skills, problem solving, time management, and to the point around constantly evolving and growing, we've also added modules on WASH, on environmental resilience, and other topics that I'll get to a little bit later. Initially we started working with a lot of the suppliers or factories that were enthusiastic about this work, who recognize the importance of investing in this, in their workers, especially women workers, who are the majority of workers in the apparel supply chain. And through that process, we also did a lot of monitoring evaluation with our partner organizations through surveys, both baseline and endline surveys, to see what impact we were actually getting out of this. Anecdotally, we were hearing from a lot of workers that this was helping their self-esteem, their self-confidence, both in the workplace to improve their communication, their problem-solving skills. And importantly, we also heard from factory management that these programs not only supported the workplace environment and communication between workers, but it also improved efficacy and efficiency. So workers felt more enabled to step up and do more work, or demonstrate their skills and their potential, and had the skills to be able to actually follow through on that, which led to a feedback loop of greater confidence and self-esteem. So those stories were really helpful. And then we also had numbers to back that up. I think we had something like about a half reported greater self-esteem and belief in their self and their abilities. A third reported better workplace relationships. And there were a lot of impacts both within the workplace, but also in their personal lives, like increase in savings, because financial health and financial literacy was part of the training. So through that, we were able to explain to our suppliers why this was a beneficial program. Not all suppliers were excited at first to participate, I think after seeing the impacts, the outcomes for workers, more and more factories were interested in participating. I will say that part of using our role in the supply chain was implementing a public goal for ourselves and implementing PACE programs across our factories. We have a goal that all of our strategic factories will participate and invest in PACE and now RISE. And, signals like that helped our factories to understand the importance of these programs. Also because it goes into a vendor scorecard that we have for our factories, which means that there is a commercial benefit to participating. So it's, there's both a carrot and a stick involved in getting suppliers to participate in these programs. And just in terms of sustainability, I wanted to mention that we are transitioning PACE into a program called RISE, which is an industry-wide initiative in partnership with BSR's HER project, which was mentioned earlier, CARE and Better Work, ILO's program on factories, apparel factories around the world. And that program is, meant to build the capacity building programs that PACE has historically done, but there's two other pillars which are focused on embedding practice in the industry to promote gender equality, but also to build an enabling environment and advocate for better policies. So those, I think, all come together in building that sustainability.
Yeah, and Emily, I'd love to hear you dig a little deeper on this. CARE has been in this since Cambodia and Sewing for a Better Future and gender-based violence, and there's so much experience. This issue of the business case and working with managers and workers and what succeeds and doesn't. I'd love to hear you dive a little deeper on what your learnings have been.
Sure, and I've started to talk a little bit about it already, is this idea of who are we trying to convince and who are the right stakeholders. And I'll just take one example with some of our corporate partners. Our individual counterpart is that team is incredible, and they're really excited. No one has talked to the procurement team about what happens when you're actually talking to a supplier. So whoever we're interacting with is incredibly supportive and engaged. And then if you look at the actual business process that big corporation is, and it's variable across corporations, but that the sort of primacy of the procurement regulations on how things get operationalized and what happens may not have translated through. So are you looking at the whole of the business? Factories are incredibly data-driven. Many of them have scoreboards that are counting, units as they get produced. They know exactly who's on the floor for exactly how many minutes. They might not need an RCT. They might need to be seeing their own dashboards going up and down. So who are you collecting data for, and who are you talking to? And what do they need to be convinced? So, I gave the example, I was in a factory in Indonesia, and the owner of the factory talked about all these different programs and what they were doing. And the first thing he said is, look, we're stocked up on training programs. We do lots of them. We've got a little bit of a backlog from COVID, so please don't give us any more training programs right now. We're good. There's lots out there. And so that's really helpful to understand about how they're thinking about what they can and can't absorb at a factory level. And then they also said, look, all of that's great. Here are the two indicators I'm paying attention to. Are my order rates going up or down? And how much lead time do I have for an order? And those are the two things that determine how I make all of my staffing decisions, and everything else is great if I can do it, but those are the two. Which means we have to work with that factory to look at what's happening with those two indicators. And how do you do, what Kamala described, which is there has to be a commercial incentive too, right? It has to be tied in. So when we think about who's at the table and who's making decisions, and that's something we've evolved and learned over time, right? We've been in this space for a very long time. The one other plug I would make is how do we take this and learn across industries? So, there's millions and millions of people and women in garment supply factories. There's 190 million women in value chains globally, right? And that might include agriculture. Does include agriculture. It includes lots of things. So how do we take that learning and then translate it across industries and bring other stakeholders to the table? Because there's a lot we can learn, and boy, we all have to be building on the best we can learn right now because we are in a very challenging environment.
And this is so interesting, the whole issue of the business case and what sells. My colleague Steve Rockland across the table and I, we did a research in discussing with 20 or so corporate executives in sustainability. And, one of these things is not only does the business case not sell for suppliers, but it doesn't sell for C-suites either. We always say, business case is essential but not sufficient, and we have to be able to understand it. But, and there are things like, Kamala, you talked about the quality, the relationship, business, the culture, and things that are hard to quantify and are also important. But I think there's another element to the business case, because we focus so much on how do we convince companies individually often too much to get those incentives right. But Sarah, you know, UNFPA has both been involved with an ROI tool on the business case, but also the public policy side, because I always say the business case is also, if you don't do certain things, you may go to jail. I mean, legal regulation, I'm overstating it obviously, but regulation and standards, and there's been obviously a big piece in Europe, and there's you have a coalition on this, and love to hear a little bit more about how UNFPA is thinking about metrics and indicators that can be part of sort of a government role in this and driving action on women's health.
Thank you. I mean, what I really appreciate about this discussion is that we do need creative solutions and we need the private sector, because traditionally UNFPA has worked just with governments, but the economic investment that's going to be needed to be made is so gigantic that there's no way that government can do it alone. And so these kind of business-centered propositions are ways where we can engage cooperatively and, you know, and I find that businesses love this. Like once they see the impact on their workers, as all these examples have shown. One thing that UNFPA has is this return on investment tool that we've done in partnership with the UN Foundation and the Good Business Lab. And this is aimed at factories and business owners and allows businesses to make projections on the estimated returns on investment in sexual and reproductive health interventions in the workplace, which results in increased productivity and reduced absenteeism and staff turnover. In short, it really helps the business case for investing in SRHR-driven programs. The interventions included in this ROI tool include maternal health, family planning, nutrition services, and other health and health information services as applicable. And it's very simple. It's an intuitive platform, and it makes the business case for investment provisioned by the private sector. Thus, it expands our ability to have coverage of interventions in the context of universal health coverage. Another area where UNFPA is working on this is we collaborated with Accenture to develop metric indicators and tools to provide guidance to companies on building effective and inclusive policies and programs to advance sexual and reproductive health and rights in the workplace. And this is part of a larger effort that we have. It's a UNFPA-led coalition for reproductive justice in business. This is a multi-stakeholder initiative, and we work to mainstream sexual and reproductive health and rights in a company's day-to-day operations across workforce and supply chains. And our metrics measure key gender equity, health and well-being indicators such as prevention of workplace gender-based violence, support for employees' family planning goals, and the protection of sexual and reproductive health and wellness. And these were developed in order to help companies develop scorecards to evaluate their maturity in supporting women's health in the workplace, but they can also be used as benchmark and targets for companies looking to design new SRHR programs and policies. And this is all part of the conversation that is happening right now on environmental, social, and governance ESG reporting. These metrics have the power to increase corporate accountability on women's health at work, as we know that what gets measured gets done. And this guidance can share the link, as we've done a comprehensive policy paper called Advancing SRHR in the Private Sector. That's all part of these multi-sector conversations that we've had. So this is some of the tools that we're developing, the coalitions that we're building to kind of build all the support for these programs and making these sort of investments.
And of course, everyone online and around this table can be part of the coalition, I believe. We're part of the coalition and happy to be part of it. And I think the interesting thing for me is, you know, we so much in the past when we got funded by USAID and other in public health was like, we can get companies to pay for this. And I think that's a mistaken way to view this because, and I'm going to turn to you, Emily, to talk a little bit about this. You know, you have government providing a mobile health service. The companies provide policies and practices that allow access to that and some cost to them as well. But really thinking about this of how the health system interconnects between labor health is a better way to think about this. And when we're trying to get to universal access, universal health care, it's really important to think about these as connected because we really have two different health systems that are disconnected and the different groups stakeholders think very differently about these issues. But you talked a little bit about COVID, and maybe you could talk about that connectivity that can be so important.
Sure. So during COVID-19, one of the places where we were working on this was Bangladesh, and Bangladesh had set very ambitious targets. They were actually one of the few governments that made not just their targets, but they made their targets on time about what percentage of their population was going to get vaccinated. And what they saw, and what we saw, because we'd been working in garment factories for 10, 15 years by then, was that garment workers weren't getting vaccinated. And when you asked why, they said, well, vaccines are available from 9 to 5, and I have to lose a whole day of work, and I can't afford it. Then I'm not sure I'm going to get my job back, because COVID was a time when a ton of garment workers lost employment. So CARE was able to call, essentially, the factory owners in the places where we were working and say, we think we can help you solve this. And we were able to work with some of the brands that we work with globally to say, yes, we would support this. We'll give the factory a little bit of a nudge, and then connect them to government vaccinators. It wasn't about saying we're going to have unregulated COVID vaccines and we're going to be sending people into your factory, but government started sending vaccinators to factories so that instead of having to miss a whole day, you could miss half an hour. That became the policy Bangladesh used for every garment factory in the country. That was possible because there was already trust between those actors, and because we had been working in those spaces for a long time, all the way from the brand level to the worker level, that we could start to have those conversations and pull those threads together. So Ashish, you talked about the importance of being a convener, right, and convening across an industry. That's the kind of thing that COVID was a health crisis and a moment where everybody had to move really quickly. So the previous investments in those relationships and in that ecosystem meant we could react to a crisis faster. But it's the kind of service that you could do that, the team in Egypt is already working on. How do you build those connections across the system instead of setting up very siloed interventions that we're going to pay to build your infirmary and stock your infirmary today, right? Or for the length of this project, is how do you build that connectivity across the system so that you can match the dots, and then you have nurses who feel like they are doing their job because they're seeing 70 patients a day instead of 7, right? And so those are the kinds of things where that maximizes everyone's investment as opposed to a bunch of separate investments that don't live up to their full potential.
So I'm going to open it up in a minute. I just wanted to say what's so interesting is we also worked with Swasti, the Catalyst Group in India, and they have a cluster model of working with factories, a lot like what you've done in Egypt and other people have done in other places. But one of the things is it's not just health, but other benefits, that they were able to help workers get benefits, health benefits and others that they're very hard to get, that they're entitled to, but the bureaucracy is difficult. And less literate and poor workers need help, and that the workplace is a way to get to government benefits that they already have but don't access. And I think that's really interesting. The other thing on the study that came out of this is interesting about the whole issue of awareness and knowledge raising, because we know it's important, but we found that when you made services available and easily accessible, knowledge might not have gone up, but usage did. And so we overthink that people have to be educated on things if you can get access. And I always talk about the role of business providing access to services, and there are multiple modalities of that, whether it's referral, on-site, clinics, mobile. There are many different ways. And I want to say we haven't talked about this, but with COVID opened up a lot of things, which includes telehealth. And I think there's a huge way to move forward on this. I think the issue for us, and this is the public policy issue, is the collective action piece, because it's not simply company by company, but multiple companies. And that's a hard thing to do. Rana Plaza and huge problems and catastrophes lead to collective action, but it's very hard to get collective action outside of that moment. So I'm going to stop now. We have people online. We have people around the table. We'd love to hear comments, reactions, experience, and questions for our panelists. We have about 20, 25 minutes, so let me open it up. Chichi. And I'd like everybody to introduce themselves and then make their comment.
Thank you, everyone. My name is Chichi Undia, and I'm a senior associate with the Population Council, where I also work as the technical director for our International Programs Division. And I just wanted to make a comment in response to Sarah's question on rights, because the issue of rights also came up for me as I listened to the really interesting presentation. But what I realized is that there's actually another take-home message from this work, and that is that when you work with others, in this case, factory workers, on the realization of one set of rights, in this case, family planning specifically, it really helps open the door for the realization of other rights. And as you said, factory workers began to soften up and began to, feel like maybe they could do more, or they could have, it sounds like something changed. Okay, so maybe the number of hours they expected people to work didn't change, but I think they softened up, in terms of, realizing that this is actually a good thing that we should be promoting. So I think that, we're not always working in an ideal situation. The rights may be constrained in a particular context, but if you just begin the work on one issue, it sort of helps open up the door for broadening rights on other issues. Thank you.
Yes.
Well, thank you, Chichi, for bringing this up, because what we noticed is that first we were like advertising the mobile clinic and encouraging workers to go there and use the mobile clinic. And like 3 or 4 months later, the workers were demanding the mobile clinic, and they were demanding adding more services. So breast examination was not initially part of the service, and they said, no, we want this. So as you said, people start to become aware of their rights, and awareness of one right leads to awareness of more rights. So this is very true. Thank you.
Yeah, I just want to add to that. I mean, back to your slide, your quotes, when the man said, I realized it was no longer a sin, because there's also, when you start to have that service, it also has that component on the knowledge of, oh, this is actually a benefit to me, a benefit to my family, et cetera. There is that learning of your own empowerment and your own rights, which I think is also key to all of this program.
David, shall we take a question from online?
Sure.
Mohammed Rashad, you can unmute yourself and ask your question.
Can you hear me now?
Yes. Yes, I can hear you.
I am Mohammed Rashad, the Sustainability and Private Sector Engagement Officer at Pathfinder International's one of the projects in Egypt called OSRA. This is also a family planning project. I have 2 questions for the panelists about the case study in hand. First one is how did the workers perceive the providing of family planning services in the factory? Didn't they get it as a way from the factory owner to get them more committed to work by having less children? This is my first question. The second one, how can you ensure the sustainability of the supply and demand of the family planning services in this way?
Do you want to take that? Yeah.
Thank you, Mohammed, for your question. If I understood you correctly, how did the workers perceive the provision of family planning services? Actually, it was a comprehensive thing. So they received information about family planning as well as reproductive health. So the workers welcomed this information very much. They did not think that this was imposed on them by the factory managers. On the contrary, the factory managers were initially reluctant to provide this information. And the factory managers were initially reluctant specifically that we talk about to have discussions and to have WhatsApp messages about family planning or sexually transmitted infections. So the workers did not see as this is something being imposed by the factory managers. On the contrary. With regard to sustainability, as I mentioned, from the start, we convened committees, health committees in each factory. And the health committee was composed of supervisors, was composed of the nurse, of the HR people, and of the health and safety folks. So from day one, they were guiding the implementation of the intervention. And they were then tasked with communicating with the health directorate to get the mobile clinic on specific day, and the clinic would know in advance how many workers they are going to see on that day. And for the last 3 or 4 visits by the mobile clinic, Pop Council and the chamber did not intervene, and this was done entirely by the factories. So we believe that all the components are there. So the Ministry of Health has the clinic, and the clinic is there and ready to provide services, and the factory nurse is available also, and she's willing to do the coordination. So we believe the intervention is sustainable. The challenge will be to take this intervention to new factories, and how engagement engagement would the population council or the chamber would be involved in that. As I said, maybe a minimal intervention from Pop Council and from ECAT, and to have from day one, to have the factories and the Ministry of Health just to facilitate the communication between the two of them. Thank you.
Dilly, I saw your hand up.
Yes, thanks again to our panelists. So I think one of the things that's really striking me listening to especially Emily and Kamala is this importance of like documentation combined with incentives. And so, you know, we've been talking a lot about the incentives for the businesses, obviously, but we know that we're still trying to make the case for health even to government. So I wonder if there's any reflection you might have on how maybe bringing businesses together with governments in these kinds of projects further incentivizes governments, and maybe what those incentives might be beyond just sort of, I feel like we're always talking about at the GNI level, but are there intermediate or other types of incentives that make themselves obvious once these connections are made? Thanks.
Emily, you want to start?
Yeah, I can start. It's only part of the answer, so I really want to hear what the other panelists have to share. But one of the things we're seeing is actually the women themselves as a huge force for that. So in India, the women who participated in the PACE program that particularly had an inflection around water, almost unbeknown to us, went out, and 130 some of those women got themselves elected to public office and then convinced their local governments to change the water supplies in their communities. And it wasn't exactly an accident that we found that out, but it was one of those, as part of your informal learning processes and conversations, that it started to bubble up, and we said, we better go look at this and see what's happening here. So in that space of like opening up some rights then opens up others, the women themselves can become agents of that when they have the tools and resources that they need. And in many ways, they're going to be much more powerful than any paper I'll ever produce that's talking about your GDP and your Gini coefficient. And so unlocking that space is really critical. And it's not something that we necessarily can plan for perfectly, but we have to be open to it and ready to support it when it happens.
Kamala, do you want to thoughts?
Sure. I think that is a really important, a really important factor. And I love hearing stories like that about the PACE program and the what skills building can do to create agents of change in communities and for governments. I think looking forward, there's another element that, will incentivize governments more and more, and that's around the due diligence regulation, particularly coming out of Europe. These supply chains are global. A lot of brands are operating in Europe and will be required to follow due diligence requirements, and governments will have to support their industry to be able to keep up with that. Due diligence requirements go beyond just tier one of these garment supply chains and further into the supply chain, all the way down to the raw commodity level. And these are a lot of tiers that we haven't historically paid as much attention to. So, I think as regulations go into effect, we will have to, as brands, implement some of these programs, and we can't do that without the support of government and government involvement. So, I think we will see both an incentive for governments to support their industry, but also sort of a requirement to do that more and more.
For those online, this is a long table, and we've been at one end of the table, but we're going to move to the other end of the table. So one of you want to ask a question? Go ahead. Introduce yourself, please.
Hello, I am Nabira Rahman. I am with IFC, actually the Better Work part of IFC. Better Work is the IFC-ILO partnership. I was based in Bangladesh until last year, and I was implementing the gender equality and returns program. We call it GEAR in brief. It's a supervisory skills training program that we delivered to over 100 factories to train female garment workers with technical skills and leadership skills so that they can progress into supervisory roles. I just wanted to share a few comments that when we approach different brands or factories, no matter how much of a great training it is, most of their initial response is always like we're really overwhelmed with a lot of trainings. And it was only after that we started to show the return on investment for which we partnered with the University of Oxford to show, okay, that it does lead to an average of 5% increase in line productivity, and that there is reduction in absenteeism and turnover and defect rates, etc. Then factories and brands and management were like way more open to it. So that's always like really helpful that we found in our program as well. Also echoing with Emily, like the partnership across like different stakeholders was also key. Like this is nothing innovative, right? Like in a sector that's predominant, like majority of the workforce consists of women, but we have less than 5% women in leadership roles. Oftentimes you go into management meetings and there's like 0 women, it's all men. So it's nothing like nobody has ever thought of, but still that is a problem, an issue that we are working to address. And yet it was very difficult, but what made it possible was that we had the relationship with the brands, we have the relationship with the factories through Better Work and worker initiatives, etc. So just to thank you again for sharing all your experiences. I think we're all unified in this, that the work we do is important and it can be more effective when we have better, stronger partnerships and more communications. Thank you.
So glad you came to be here. I was thrilled that you'd be here and make those comments. Go ahead.
Thank you. My name is Natasha Sokolsky, and I am also with Pathfinder International, although I'm based here in Washington, D.C. Thank you to all the panelists. I learned a lot during this session. 2 questions, if I might, one bigger, one small. Those who opened this session talked very clearly about the intersection of climate and health and the growing impacts of climate change on the garment industry and factory workers surrounding communities. Yet I didn't quite hear that in the presentations. So I'm wondering if there were nuances, angles, interventions to address that nexus of climate and health, climate resilience and adaptation in the work described, and if not, what would it have looked like had there been? Sort of, what do we need to know for the future in the spirit of learning and doing? What are the must-dos? And then Nahla, thank you for the invitation today. My other question is for you, and it's specifically with regard to the WhatsApp messages. And I wondered if there were any issues around privacy and confidentiality in sending, receiving, and if so, how those were managed. Thanks.
So we'll take your first question second and allow our panelists to think about it, because it's a question I wanted to ask. You asked it much better. And then, but I'll let Nahla answer the second question.
Start with the easier question, the one on privacy and confidentiality. We debated a lot on how to compose those WhatsApp groups. So they were it was unidirectional. So the peer educator sent out the messages to everyone. If a worker had a question, this was sent in privately to the peer educator, and then the peer educator would communicate with the nurse, get the answer to the question, and send it back to the, because we were concerned about, and of course all the groups were one gender, so a male peer educator sending out messages to male workers and so on. Yeah, thank you.
So Sarah, I'm sorry. Sarah, Thoai, you want to?
Yeah, thank you so much for the question about climate. We work on the climate crisis, so we think about it deeply. I think generally, I want us to tackle this question in in two prongs. One is macroly. I think as a sector, I think many people in this room is from the health sector. I think through my learning, I think it's important that the health sector is important to been advocate for health funders, health advocates to talk about climate much more clearly. It took 28 COP for us to get health on the agenda. And I think that's not, I wouldn't say that's a failure from the climate community. That would be a failure on the health community. So I think we need to really kind of upskill ourselves on how to talk about this issue much more adamantly in terms of, I think I was just sharing Dilly. I was in Thailand for work, and just, there was a heat wave, just seeing like street vendors, for instance, and there's no way to protect them and etc. I think we can't just ignore it, yeah. And I think, so I think that's one angle that we need to learn. And I think it's a new way for us to really think about this. And some of this intervention happened before the climate, before there's more attention to the climate crisis. That's why it hasn't been working. But I am encouraged by a project that we are working in India, in Population Council India. It's not factory workers, it's mostly men working in construction and really thinking, negotiating with their employers on how to take rest. And even in this country, labor rights movement have a strong emphasis right now, thinking about construction workers, those who work outside, and thinking about how to negotiate for this rest period, as it's very critical. We know very little on how heat, for instance, affect our body, both as an individual and as a group of scientists. And so I think we just need to pay attention to it a little bit more. Thank you.
Great. So let's start from this end. Sarah, your thoughts on this?
Okay, I'm going to try to stay positive. I think the overarching on all of this, right, is how we do not leave women and girls behind. And I think we've had everyone alluding to the political climate or the environment. And when we project forward, when we look at climate, we also have to look at humanitarian crisis, which are often climate. There's a link there. And who are the last served, who are going to be the most impacted are women and girls. Climate change impacts women's ability to have a good, healthy birth outcome. It has impact on increases in domestic violence. We also saw that during COVID. All of these are linked, and a need to have gender equality. And so all of this is regarding political will and the lack of investment in laws, policies, funding programs impacting women and girls. So the positive is everything we're talking about today lifts that up, creates all those synergies, and shows success. And we need to have those kind of similar creative solutions addressing climate and women and girls. So let's take the lessons learned here on what works and have private sector realize when they're making their ESG determinations that the gender piece has to be in there. The SRHR piece is fundamental and key to that overall piece on gender equality, because if you don't have the ability to control your bodily autonomy and make those rights and decisions about your body, nothing else is going to work.
Komala, your thoughts?
I mean, I think there is clear recognition that the climate issues are very time sensitive and growing need. David, you mentioned the Cornell Global Labor Institute report, and I think that report really highlighted the need for the apparel sector to look at issues around climate resilience, particularly heat and extreme weather events in factories and their impacts on workers. And I think there's, the disproportionate impact on women cannot be ignored, women and girls, through this process. And so what we need right now is more collaboration. There's a lot of collaboration that has to happen between brands, partners like IFC, ILO, Better Work, I think there's a number of steps that we have to take in order to address these issues effectively within the apparel sector. One is gathering the data and evidence that we need. I think understanding what kind of data and evidence is necessary to understand the impacts, better scientific research on the health impacts from heat. But I think a better understanding of not just heat, but issues around humidity and how that affects health. And then development of standards, right? I think the U.S. government has issued some standards around heat and labor, and we can build on that, understand that. And so it's not necessarily a negotiation between workers and their employers, but actually a science-backed standard that dictates or guides employers on how to address heat in workplaces. So hoping for more of that collaboration. I think there's a lot that we need to do and build on, and we're not quite there yet, but I think there's recognition that it has to happen.
One thing I would add is, as you know, I mentioned before, the idea of having the right set of stakeholders at the table. One of the things we often see is your E people are different than your S people in ESG. And so the worker health piece is S, right? And I was on a panel earlier this year where they literally invited me because they said, well, we're having an ESG panel, and we don't have anyone who can talk about S. And so that idea of bringing those spaces together instead of treating them separately, I think, is really important in this work. And the underpinning of gender equality is the ability to deliver on either of them.
So we'll take one from.
Well, a quick comment on the climate piece. I think we really have to meet the moment on integrating climate into our work, because in the two geographies that I talked about where I worked, Cambodia and Bangladesh, it was very much understood that the seasonal flooding and sort of the cycles of flooding really brought women from the rural areas into urban areas to find work, to sustain their lives. And a lot of women found very consistent work in the garment sector, and some of them stayed. But there was this cycle of migration back and forth. However, with sort of these intensive cycles and with flooding getting more intensive with climate change, we were finding that more and more women who were previously maybe deciding to go back home were no longer doing so because they'd found sort of a home in the garment industry. And when we did this work 10 years ago, and perhaps in Egypt more recently, I mean, at least in our work, we didn't include climate as a component, even though we understood that it was one of the driving factors of the migration that led to sort of significant, numbers in the workforce. But I think that is, really key. And thank you for bringing that up. And I think that's a lesson that we should take home. I don't want to neglect folks online who have sent lots of comments. We don't have any hands up, but I would like to maybe, there are a couple of comments online which I think the panelists really anticipated. It's like you knew what they were going to ask. There was a question about sort of what sort of financial gains do factories and manufacturers get from such investments, and you talked about the ROI tool. I think that's a way to really, concretely say what that is. There were also questions about how to sustain programs, that it's not sort of a one-off project thing where it can continue. And there was a very interesting question about, what is it that really convinces a factory manager or at the corporate level? Is it about improved productivity? Is it about regulatory mandates? Do you need a government decree to say you have to have not only an infirmary, but you have to do X, Y, and Z? Or is it altruism? So that was a question, and maybe the panelists could reflect on that a bit. And there was an example from Vietnam that the women themselves in Vietnam, not sure exactly where in Vietnam, but that the factory workers themselves pressured the companies into investing into health initiatives. So maybe some reflections on that would be useful.
So why don't we do this? The panelists think about that question as sort of a final thought, because it's all about the idea of driving what changes, what drives investment and change. I know, well, I thought we had one more question over here, but so I'm going to take prerogative because we talked about the knock-on impacts. I call it the curb cut. We talked about how it improves many things in a factory, but it also, and Emily, you talked about this, but I'm going to turn to Cynthia. Sorry, I'm putting you on the spot. That this isn't just about what happens in the factory, it actually affects communities. And you have a great story, and I always love telling you about the work in Haiti with peer educators. So maybe you could tell that one story about family planning and the experience and how that gets out of the community and helps more broadly. Turn on your microphone, please.
Thank you for that, David. And Am I on? Am I not close enough? Hello, hello. Okay, thanks. So I'm just really delighted to be here. Thank you, panelists. I'm Cynthia Pedersen, doing, it seems like waving the only banner in Haiti about workers' health and garment workers' health. But anyway, that's my perspective. I feel just really encouraged by what I've heard from the panelists, from what's happening in Egypt. That just really excited me, and it was an affirmation of many of the things that we have done. We've been running these programs, first the HER Project, 2014, straight on into the PACE, and now we do a combined type of implementation of both. But there are just a lot of things, but to speak specifically to what matters most to us is how it changes the lives of the workers, how it changes the women. And the story that David is referring to is just the peer educators began to take on their identity, their complete identity as a peer health educator. And so if they would meet random people and say, oh, what do you do? Oh, I'm a peer health educator. Well, they don't know what that means, and they're not getting paid for it. They're a factory worker, but that's where their identity began to come from. And in particular, one that was, and this led to two things, but one that was really quite wonderful, a peer health educator was in her local community, going to a small pharmacy, which is some, storefront, and she was waiting her turn. There was a woman speaking with the pharmacist, whether he was certified or what, we don't know. And the woman had said to the pharmacist, I ran out of my oral contraceptives and I stopped taking them a few days back, and I need some more. And he said, okay. And she says, well, what should I do? Do I just, just keep taking them? And he said, yeah, just start taking them and you're fine. And this woman who was standing and waiting her turn boldly steps up and she says, no, madame. If you miss a day, you need to double up. If you miss two, you double up, and then you need a backup form of contraception, so get some condoms. And the man looked at her, he says, oh, are you a nurse? She said, no, I'm a peer health educator and I'm certified. And so, but I mean, this story has been told several times, and when it came to us, that was an aha moment. All of the information they were learning in the factory, they took to their communities. We know that you're going to take it to your sister and your best friend and your cousin and whatever, but they were really taking this into the community. But interestingly enough, what this also led to is an understanding of the workers on the factory floor that the nurses inside the infirmaries, which are required by law, and their certifications were questionable, these nurses, but the peer health educators knew more about many things, particularly contraception, than the nurses inside the factory. And the nurses began to feel uncomfortable that they had these sewing machine operators walking around with all this information that they didn't have. So what we said is, okay, fine, we need to fix this real quick. And we began giving health education, sort of continuing education to the nurses. And after we had trained them on the whole panel of what the peer health educators knew, and we also told them, oh, don't worry, we're going to be doing this on a more scientific, professional level, and so they felt better about themselves. But it's an ecosystem that begins to multiply itself, and that's what matters the most. So
on that note, we're going to ask each of one short comment on driving this sustainability, and then Ashish will lead us out. We're at noon, so Sarah, you start, and we'll come down this way.
Well, I'm going to steal that story. That's an amazing story. Thank you for sharing it. I think it's all of those, and I think it depends situationally, et cetera. I like to think sometimes it's because it's good for business or the altruism piece, but I would agree with you. Fundamentally, it's the empowerment piece of those women and the health benefits and that investment in their personal autonomy and health and well-being.
I would agree. I think, it comes from a lot of different places for different companies. Some are driven by regulation, others by altruism. I think an important factor to remember is the employees of the companies also want to be working for a company that does programs like this and supports women in the supply chain or workers in the supply chain. So I think, we have to have a multitude of different approaches to get this done, but I'm really excited about all the programs that we learned about today and look forward to how we can collaborate and build together.
Yeah, and I would say very much agree with my fellow panelists, and I'm going to steal the idea of the ecosystem, right? Is that this is an ecosystem we're operating in, and what we need to be thinking about is how do we design what we're doing to amplify the ecosystem without letting it overwhelm us, without trying to tackle every piece of it at the time, and how do we partner together to say, here's how these bits can come together to create that engine that will continue to grow.
Nahla?
Agree with all of the above. I wouldn't say regulations because we know that rules are made to be broken, and there are lots of infirmaries, but they are understaffed and underutilized. So building the ecosystem and empowering workers to demand those rights, as well as also some pressure from the contractors so that those suppliers would comply. And finally, showing data on return on investment. Thank you.
And shameless plug for the Coalition for Reproductive Justice in Business, as well as our accountability platform, is really a sort of a loose network of different organizations trying to come together to drive systemic change on health, women's health, and gender equality related. So over to you to take us out.
All right.
Ashish.
Before I take you out, there was lots of interesting ideas shared on the chat, so I don't want anyone to miss that. So we will be sharing some notes from the online version of the discussion, as well as our presentations. I think that those might be of interest to you. I'd like to really thank all of our panelists for such an insightful panel and for all of the discussion, both here in the room as well as online. And it's been a great pleasure to have this discussion. I think now it's on us to take this forward in our programming, in the work that we do. And again, to thank our leaders for speaking at the beginning, and for His Excellency, who may not be online with us anymore, but for his time. Thank you all for coming. And we do have lunch, so I hope you will join us for the next hour so that we can meet each other and talk more about and take these discussions forward. Thank you so much. Thank you.